Let me talk to you about female veterans, because we're seeing more and more of them coming back with PTSD, and there are gender differences. How do you approach that differently as a therapist?
Well, we should be aware that many female veterans of this war have had abusive situations before volunteering, and unfortunately there's a fairly high rate of abuse, harassment, and even rape to our female soldiers. The experts in the field know about this. There are all kinds of prevention programs and awareness programs. In fact, you and I spoke with the Judge Advocate General of the Air Force, who cares a lot about this situation. But the therapist needs to be aware, and this may not be something that comes out early in therapy. A relationship that is something like an acquaintance rape while in military service is a little bit more like incest than other forms of abuse, because this is your family, and there's a lot of pressure to keep things secret. And in some ways, the female veteran realizes truthfully that she's damned if she reports and she's damned if she doesn't report. As a therapist, knowing what you know about working with incest survivors can give you some insight and some tools of the trade, even though it's not incest.
It might not be top of mind, though, for a lot of therapists to approach it that way.
No, it might not be. So be aware of that. And if you've had good outcomes using some of the workbooks that are there for helping an incest survivor, you might actually want to consider about how to adapt that for your female veteran who's been sexually taken advantage of while in service to her country, and who never would have thought of this like incest. This isn't her father or brother, but in a way it is.
What I find interesting about the paramedics, the firefighters, and the police officers, in many cases the therapist has to assume that role that you were talking about with the female returning veteran, that an advocate in many ways. Talk to me about some of that work that you'll do with these type of returning vets.
Well, sometimes it's advocating for them to stay on the job, have accommodations for the job, and it could involve writing letters. I have offered to call an employer on behalf of a client, and it's rare that someone has wanted me to do that, and that may be taking things a little bit too far for some of this group of patients and clients. But Mike, there are situations in which a person returns to a civilian job and they can't do it. They don't have the resilience, the capacity to be a firefighter, or they're, for a period of time, way too angry to be an effective law enforcement officer. And here again, my philosophy is I'm not going to take damaging information about my patient to some authority. I'm going to talk it over with my patient. But if my patient reaches the point where he or she says, I really need a different job, it's my job to help them with that transformation.